we will go ahead and get started. It looks like everybody's been able to mostly filter in. And so I want to welcome you all to the Minority Health Disparities Initiative's Health Equity Speaker Series. Today we have Dr. Julie Tippens, one of UNL's own, participating in the Health Equity Speaker Series. Dr. Tippens is an associate professor in the Department of Child, Youth, and Family Studies at UNL. She is a global health scholar with 2 decades of experience as a practitioner and researcher with populations affected by forced and survival migration in North America, Central America, Southeast Asia, and East Africa. Her current research focuses on refugees' resilience and health promoting strategies in resettlement, humanitarian settings in the U.S., Kenya, and Tanzania. As an interdisciplinary community engaged investigator, Dr. Tippens blends ethnographic, participatory, and visual research methods, which we'll get to hear about some of those today to understand the sociocultural and structural determinants of refugees' health in diverse contexts. I'd like to also mention that Dr. Tippens is a part of our MHDI Leadership Council, and she is the coordinator for Immigrant and Refugee Health subunit. So with that, I will turn it over to Dr. Tippens. Thank you for joining us today, and I look forward to the talk.
Thank you. Thanks so much, Trey. I should say I'm an assistant professor. I did just put in my dossier for associate professor, so fingers crossed, I guess from your lips to God's or the God's ears, so to speak. But yeah, so today, sorry, I'm just doing one thing. Okay, I'm just, if nobody can hear me, you should be able to still hear me. Let me know. But thanks so much for attending today's presentation on using visual and participatory approaches to identifying refugees' health and mental health promoting resources. So the research that I'm presenting is really part of a collaborative effort with really talented students, community partners, and faculty colleagues. I've listed all of them here. I very much consider them co-presenters, co-constructors of a lot of this knowledge. So I just wanted to give them a shout out, especially for the Photo Voice project that I'll talk about a little bit later. Oh no, and I cannot advance my slides and I'm not sure why. Okay, there it goes, sorry. Okay, so I will introduce myself today and then hope to learn a little bit more about all of you who are attending. I'm going to provide a broad overview of participatory approaches to assessments, evaluations, and research. I'll give a handful of examples that can be used in these different areas or some procedures to enhance community-based or community-driven work. And then I will give an example of a recent Photo Voice project that we completed with colleagues with the Yazidi community here in Lincoln, Nebraska. So a little bit about me. I'm an assistant professor in child, youth, and family studies at the University of Nebraska, Lincoln, and the Immigrant and Refugee Health Coordinator at MHDI. Before returning to graduate school, I worked with refugees in various humanitarian settings in resettlement, including as a refugee health coordinator in Philadelphia, and then in advocacy and policy at an international human rights non-governmental organization or NGO. I wanted to learn how to leverage different refugee groups' resources to promote well-being at community and population levels outside of clinical settings. So really looking to combine public health approaches with some of these rich cultural methodologies from medical anthropology. And I see myself as a narrative public health researcher. My mentors would say that I'm a public health anthropologist, but I really see myself as kind of first and foremost a public healther who uses anthropological methods and approaches. I don't share the backgrounds of any of the participants I work with, so I've never experienced forced migration myself. So I'm always an outsider in my research, which has shaped kind of my research worldview, or what one of my mentors, Mark Nichter, would call my research cosmology. He said worldview is too small, too limiting. But it's shaped it so much as that I focus on cultural humility and try to position myself as a learner and facilitator of research. So within that, I see participants as the experts of their health, illness, and healing experiences. I try to center people's narratives. I really think stories are critical to countering the deficit-centric approaches that are so common across the health sciences, even though I think we're getting a little bit better in the past couple of decades. I've seen that growth. And I do my best to research with, not on, and pass the mic when possible. I'm not always perfect at this. I've made mistakes. I'm happy to chat about those, as we all do, but I do think it's an important endeavor, and I'm really excited that I have such great colleagues to do this with. Okay, so if everybody could I just would love to get a sense of who's here, and I'd love to know about your current role, and if you have any kind of guiding philosophies um, or something that motivates you, something that you love about your work. If you could just take a minute and type that in. I love that, so that there's an opportunity for learning in every experience. That's a really great approach. Ah, some of our students are here. Yeah, so wow, okay, so we have people representing UNL from the community, so doing a lot of really incredible work, which is exciting. Yeah, so this is great. Okay, so a lot of exciting people. I will, at different times, kind of call upon your expertise to share with all of us. And in this talk, I think we can all learn from each other. Everybody's doing really incredible work. So just be prepared for that. Okay, so now I'm going to segue to participatory approaches to assessment, evaluation, and research. And there are certainly crossovers among these three. So with refugee groups or different communities, participatory approaches really just refers to any activities that help build relationships and equitably involve targets of activities. In research, we would call these participants. When I've worked in community settings, beneficiaries, or program project beneficiaries, and including them from planning to implementation to post-program evaluation and dissemination. Even though I will say evaluation should start. For those of you who teach or who do evaluations, I do recognize that should start earlier than post-evaluation. The photograph here is of a participatory social map. I'll cover that as one of the approaches a little bit later, but it's one of my favorite things to do in field work. And working with different communities to start to see the world through different people's eyes. So increasing community partnership and participation is a way to enhance mutual understanding, to start to see the world through different lenses. One of my mentors always said, life is, you can think of life as like a camera. If you're just using your 35mm lens, for anyone who's interested in photography out there, it just gets really, really boring. So you want to start to look at life through different lenses. It's a way to show respect for different expertise, for local expertise, to improve research efforts and the accuracy and meaningfulness of our research findings. And then to start to collaborate and think about who we need to address some of these wicked problems or these really complex challenges with lots of root causes that overlap. With regard to research, I just want to note that participatory approaches are often seen as this kind of qualitative set of methods, and it's an approach or an orientation to research. So it's not a method or set of methods, and depending on your research question or what you want to find in your assessment, you can use quantitative if you're looking for percentages or number of people affected by something, qualitative if you're looking for that rich input, or mixed methods design. So you can use anything within this. It was probably earliest adopted by qualitative researchers, given the way that we think about things and use reflexivity, but it does embrace all of these different research designs and approaches. One of the main tenets is that it's applied and really looks to influence change to promote health and well-being. So Hacker talks about this continuum of participatory research, ranging from investigator-initiated to community-initiated. And I just want to say, for any kind of early career researchers or people just starting this, It is totally normal that you're starting with investigator-driven research. I would just say in those cases, you just want to try to find stakeholders in the community and say, like, is this something that's relevant to the communities? Like, how could you maybe use the findings in different ways? But there's so much meta research on CBPR or on community engaged approaches, and people usually start out with very investigator driven projects. And even now I'm not totally at the community driven. I would love to be there, but I'm really between community-based research and community-based participatory research. And I'll talk about what CBPR is right now. So CBPR focuses on equitable partnerships, community strengths, and co-learning to conduct sustainable, action-oriented research on issues of importance to the community. There are a lot of other forms of participatory research. Some of you might use participatory action research, PAR, youth participatory action research. CBPR comes from the public health world, and that's kind of my comfort zone or area. So to address known refugee health disparities in US resettlement alone, CBPR has been used to identify strategies to prevent chronic diseases like diabetes and hypertension, to increase access to culturally sensitive care, to identify strengths and resources to work toward improved mental health and psychosocial health status, and to address family planning and sexual and reproductive health. So there's really a wide spectrum that it's been used with and for. I do want to say be careful because CBPR recognizes community as the unit of identity, but whenever you're looking at approaches that focus on community as a unit, you just have to be careful because all of us have different experiences. This is certainly true of refugees who have vastly different experiences, even when they're from the same country, and they might not view themselves as belonging to a specific refugee community. This is particularly true when we're dealing with ethnic group tensions that are things that don't just fade when people move to a new place. So it's important to assess people's communities of trust or communities of belonging. And just like all of us, refugees have different places where they feel safe, or different groups that might be based on ethnicity, it might be based on country of origin, it might be based on something like religion, where people might actually feel safer with people from the host community. Another question is thinking about CBPR, which is usually done at the organizational or coalition levels, thinking about representation at these levels, and do we need to, I would say we need to both enhance representation at the different levels, but we also need to think about how to do multi-level CBPR so that we're reaching different groups of people. Okay, and this is going to be one of those times where I call on your expertise, and I would love to learn some ways that you are involving community members, whether they are people with refugee backgrounds or otherwise in your own work or research. And I'll just give everyone a little bit of time to think about this. For photo voice, I love photo voice. So we'll have to compare notes. Excellent, yeah, involving community members and focus groups. Dr. Paul Springer, CBPR in the favelas of Brazil, thank you. So there's a lot of great insight on the call. Nice, so these kinds of like in-depth interviews that seek to get insight, even great, thank you, Patrick, Dr. Habecker, looking at how you're designing your research questions through support groups, direct support. Nice, so getting input from in a lot of different ways, this is great. Yeah, follow attending community events. That's a really important one. So for those of us in kind of the academic spaces, getting out there, getting into the community. Terry's talking about partnering with community organizations to guide study focus and design. Excellent. Yeah, being on community boards and committees. I'll talk about my involvement in a local committee in a little bit. Okay. Oh, I forgot to put a pretty picture here. I apologize. I try to be better visually with PowerPoint slides. But in this section, I'm going to share some examples of strategies and procedures that can be used with refugees or other groups. So certainly not with refugees alone, but that are participatory. Visual methods are often used in cross-cultural, qualitative, and participatory research, and they're used to build rapport with people from different cultures, to facilitate communication of ideas, especially tacit knowledge, which are those ways of perceiving the world so deeply that we don't even think to respond if somebody's asking us a question. We just assume that that's kind of universal knowledge. So our worldviews, it's a really, visual methods do a great job of getting into those kinds of areas. And then finding insight into people's like inner lives or these kind of hidden worlds that might not be fully accessible to researchers or program designers and such. What I love about visual methods is that it has the potential to center participants or beneficiaries' expertise at all of the different stages. So from assessment to evaluation to even these end products of dissemination, depending on how people want their words or their visuals or their stories disseminated to different groups. Okay, and now I'm going to kind of, I realize that's like a cross transition, but those of you who really focus on health, well-being, I will say that I view health like the World Health Organization. It's not just disease-centric, but it's really the state of broader well-being. So what are some indicators or ways that you use to assess health, mental health, or psychosocial well-being? And I'll give like, while people are thinking about that, I'll give kind of common examples. So sometimes in public health, we look at numbers of emergency department visits, which tells us something about access to preventive care. Oh, nice. Okay, the social vulnerability index, social determinants of health. Yeah, ER visits, reaching out to community health workers. Good. So what are people's experiences? Traumatic brain injury screening. So different types of screenings. Nice. So we have everything from kind of this individual level health to broader community health, which is really excellent and exciting. So there's such a diverse group of people on the call. Okay, the Prevention Institute has identified 18 indicators associated with overall health status. And although these are separated into specific categories, I think a lot of them are really quite cross-cutting. So equity, racial justice, access, trust. These are things that just aren't neatly boxed into one area, but for the purpose of serving as an indicator, I can understand why it's been done. So these are often measured using things like the number of houses for sale or the number of rent signs that you see in neighborhoods, which tells you something about kind of how long-standing the population might be. Different things like that. I love the what's sold and how is it promoted. So if you're doing a tour of a neighborhood, what languages, if there are different signs, what languages are those signs in? Who has, are there ramps at buildings? Thinking about things like access. So these are some kind of baseline indicators. Oh, yes, we will get a slide deck. I'll send those out to everyone. Great question. Yeah, and then one way to engage communities in identifying indicators, it's kind of a quick and dirty way before we get into some of the different approaches. Whenever I'm working with a population that's new to me that I haven't worked really, really extensively with, and that could include a subgroup of population, like I don't work with youth or children, for example, despite my department, but so I would always ask, like, what does health mean to you? And people like you in your community. So if I'm working with women, it might be, what does health mean to you and other women in your community, for example? And then what are some of the resources that you need to feel healthy or to be well? So it's a kind of, again, a quick and dirty way to just make some of our research questions and findings a little bit more salient to different populations. Okay, and before I transition to some examples, I did want to highlight some of the ethical concerns that were listed about participatory approaches specifically. And the UN Refugee Agency listed this out so that we always need to be sure that we're safeguarding the well-being and the rights of structurally vulnerable groups. That might be women, unfortunately, with participatory research, with the increase of that, we've also seen an increase of violence against women in household settings because people are able to participate more. So that's happened a lot in refugee camps. There's some literature around that. Undocumented individuals, you never want to send people when you're doing some of these approaches to places where they might be unsafe or that makes them or that increases this sense of structural vulnerability. Always talking about the limitations of the project and what you're hoping to learn so that you're not raising false hopes about making broad changes in the community. Participation should always be optional, as should any information that is shared for those who are participating. So anything that makes people feel embarrassed or uncomfortable or makes them relive traumatic experiences needs to be attended to. And I would say in that context, it's important to think about what community resources do you have if you are doing really sensitive research. And then describing how confidentiality is being protected or what are some of the threats to confidentiality. And when we're working in group settings, it's really impossible to protect confidentiality fully, but you can talk to the group to set social norms and how and what people want out of that, how they want the information shared. And that might be things like, please don't talk about this outside of the group. So it's not 100% accurate, but it is including people in the process. And then always follow up with the findings in different ways. A lot of people aren't reading our very expensive paywall protected academic articles. So think about other ways to share findings, whether those are community reports or town hall meetings or an email, and then figure out ways to collaborate on next steps. Okay, and now for some different examples. So there are lots of ways to get community input into ranking priorities. These are two that I use in my own work, whether I'm doing, whether when I was working with non-governmental organizations or NGOs or in academia. They're things that I really like. The purpose of prioritization or ranking exercises is to identify and prioritize community health issues. So this entails asking people about their priorities and then having them vote on which ones, on how they would rank these. So the way that I've done it, there are different ways. Every participant receives 10 stickers. I use stickers a lot. I use sometimes seeds or beads that you can get at like Michael's Crafts. And then everybody receives 10 and they can distribute them however they see fit. So that means that if one person wants to have all 10 beans or stickers in one area, that's completely okay. I have seen people do it where you're kind of you're only allowed to use one sticker, but then kind of every issue gets a sticker. So I haven't seen the benefit of that so much. When generating free listing, or free listing to get information about some of the issues, it's important to separate groups into like people when possible. So older adults, women or men, we don't always know sociocultural norms that could limit participation. And then different members of communities have different challenges and priorities. So older adult refugees, older refugees and young refugees have vastly different experiences of resettlement, and they're going to have different concerns thinking about their health and well-being. Mapping is something else that I really love to use, and I do a lot of markers. I love these because they're just so low tech, and I'm a very low tech person. So it's one of my favorite ways to kind of understand how people see and engage with their environments. I usually use something that's like the size of a flip chart piece of paper and markers. And I ask participants to draw their neighborhood and then ask a series of prompts. So these could be things like, where do you feel safe? What are some places you avoid? And then asking why, asking about like specific experiences. Where do you seek health resources? If you're feeling sad or if you're thinking too much or you're dealing with stress, what are some places that you go? Where do you visit? And that gives you a lot of insight into how people perceive the institutions around them, if they're accessing formal or informal resources. I think this is really important. When I was working at NGOs and we've done this, sometimes the NGOs that I've worked with never get mentioned, even though we provided really important services. And then you ask, why, what about this? And it might be, oh, it's too far. So that tells you that maybe you need to do more outreach. If they, and another thing that I've seen come up with the United Nations, specifically when I work in both Tanzania and Kenya, is that unfortunately the UN has been involved in sex for resettlement schemes and cash for resettlement scandals. And these are things that are very true, even if they've happened years ago, but that those experiences are well known in the communities, and people, once you've kind of lost trust with a group of people, it stays that way for years later. So when I do research, I still find that people will say, no, there's no use in going to the United Nations office to apply for refugees, or to apply for either refugee status or try to apply for resettlement. I don't have money, they exploit people. So these are things that might influence people's perceptions of an agency for years to come, and it's really hard to get that trust back. Two mapping examples that kind of show how low tech or high tech this can be is this project in Ecuador, which was used as a stakeholder exercise to understand different community boundaries, whereas the Kibera map, and Kibera is an informal settlement, or what's locally called an Uswazi or a slum in Kenya. The Kibera map was designed as an open resource for people living in the settlement. And this is because the government of Kenya had never bothered to map Kibera. So people, I think it was a team of researchers actually from an academic setting. I forget it, sorry if it was a university or an NGO, but they went in and they taught youth living in Kibera how to use this incredible open access phone app. And then they had people go around and map things like pit latrines, which are toilets, so that people knew where to use the different bathrooms, different health clinics and what kind of things they helped with, women's health resources, schools. So it's just, and then it was downloaded by people living in Kibera as this incredible local resource, and it has been replicated in different areas. So with mapping, you can be, again, as low tech or as high tech as you want, depending on the purpose of what you're doing. But it's important to involve communities and participants in different ways. This slide probably dates me with using Ace Ventura, but walking or driving tours are other ways to learn about the physical environment of places. These often center on looking at like the conditions of roads or houses, the utilization of public spaces. If you do decide that this is something that you'd like to see, it's very important to go at different times. So you'd want to go during the week and on a weekend, in the morning, afternoon, and evening to get a better sense. And then when I do this as a participatory, they're not always participatory approaches or methods, but when I use them, I always go with people from the community and just ask a lot of questions. So you want to talk to people. Do you live here? Tell me a little bit about it. I do want to say, if you are interested in maps, the Community Health Endowment of Lincoln has a beautiful series of Place Matters maps that can tell you some of the things that you might be looking at. And those are things like the life expectancy in different neighborhoods of Lincoln. I think housing, there's a poverty overlay, and they're really beautiful tech-savvy maps that tell us a lot about our environment. Okay, and then pile sorting. I know I teach methods, and this is always something that students really love as an exercise, especially some of my mixed methods minded students. So this is a really great way to understand how categories or how people categorize or group behaviors or information. I usually use about 15 to 25 cards that contain images, words, or both. And have participants generate their own words through free listing, which is just asking people to write down whatever words they think of. So this, the visual focus is on malaria. So asking participants, like, what do you think of when you think of malaria prevention? What do you think of when you think of malaria treatment? And then asking things. There are presets like this This is a card set that you can buy for public healthers going to malaria endemic regions. I don't like to do that because I think it misses a lot. And you can tell this is like the way that they're selling it, because I don't know a lot of people who use insecticide treated bed nets and call them a good thing. When I work in malaria endemic regions, they're usually kind of stuffy, they prohibit airflow. So I think a lot of the people I work with would include them under bad. So we do need to find some, just for anyone doing public health and malaria, if you're out there, things to think about. But before doing that, and something also to talk about is that good, bad, not relevant, or just some labels that we can use. Usually I ask participants to sort cards first and then group them without prompts and ask why they grouped them that way. And then I'll start asking prompts. And prompts could be anything from, like if you're looking at who is using certain resources, if you're looking at like something like a wealth index, so it could be people living in poverty, middle class, wealthy. Those might be replacements for good, bad, not relevant. They can be all sorts of different things. And some examples of cards, if you're thinking about stress and coping, when I've talked to Yazidis, and a lot of these are coming from older groups, and then kind of like emerging adult men, they'll say things like, sometimes I just go party with friends. Older women will often say that they pray when they're feeling stressed. Are people going to therapists? So seeing how people sort those and what they think of them. And this is a great way to just understand how people think about like how they're categorizing their social worlds. Okay, and then 100 seeds is a really nice way to look at how households are distributing resources or using resources. So participants are given 100 seeds or beads or whatever to represent the monthly household income. And then they're asked to divvy those into different expenditures. So those might be things like housing, healthcare, let's see, so housing, healthcare, education, or childcare. So looking at how participants are spending their resources, if there's an ability to save, if you're really focusing on kind of building wealth among populations, this is a good way to see how people are using resources, and if there are existing resources in the community that could help them maybe use fewer resources and start to save money. Okay, and then finally, digital storytelling and participatory theater are other participatory approaches. Full disclosure, I do not use these because I do not enjoy being in the spotlight. So they stress me out to think about, but there are people who use them, and they have participatory theater and storytelling has incredible success with work around mental health and caregiving. It's a really nice way to understand people's decision-making processes and then their hopes and expectations. If you have people involved in writing stories, what kind of endings would they write? What's kind of the hopeful ending? What is like a realist-based ending? And it lends a lot of perceptions into that. So there are, again, researchers at UNL, I'm sure people in the community using these. I'm not one of them. I'm happy to send resources that exist. And that's just my own. We talk a lot in qualitative research about researcher as like the research instrument. And I think that this is so true for me with this. Even looking at the slide gives me anxiety thinking about like standing up in front of an audience like that and telling someone's story. Okay, so with that, these are some of my favorite resources. So the community toolbox is something that has everything on how to do community assessments, how to engage participants, how to think about evaluation differently and get increased participation. The CDC has a few different resources. Preventing Chronic Disease has some publicly available articles that are usually talking about or often talk about participatory evaluation, participatory approaches to focusing on different areas. USAID is the same. And then one of my favorites is the Switchboard Technical Assistance for Refugees program. which was founded by the International Rescue Committee. And you do have to set up an account and log in using an email, but it's completely free. And this is just one example on the screen of using participatory methods for monitoring and evaluation, getting increased involvement. But if you search participatory, there are a range of resources, and these might be like how-to guides or recorded webinars, things like that. And that is specific to refugees. And because we have such incredible expertise on this call today, if you would all really, if you would like to share some of the resources that you use in your own work, that would be fantastic. That might help others. And thank you, Callie typed in the Community Health Endowment of Lincoln. Okay, I'm not seeing any right now, but if you do know of any and you want to type it in, what I can do is PDF those resources as a guide. You'll also get the slide deck, but I can add those to the PDF guide if you would like. So whenever you want, just feel free to type it in. Okay, and then finally, oops. Okay, and then yeah, the final segment of today's session is going to focus on a collaborative photo voice study with ethno-religious Yazidi women in Lincoln. So this is one of the publications that came out of this, which was quite exciting. And the purpose of this research was really to document women's health priorities and perceptions, to understand some of the stressors that they were facing, and then to identify different health promoting resources in the communities. We chose Yazidi women because we were working closely with the New Americans Task Force Mental Health Subcommittee. I'm an active member of that committee. We have monthly meetings, and they wanted to focus on newcomer refugee groups. So in Omaha, that was Congolese women. That project did not go as planned. So if anybody wants to ever chat about a failed research project, I am more than happy to do so with that. We made a few mistakes going in. That I'm really responsible for. And then the Yazidi women from Iraq, which was a really fantastic project. So that took place in Lincoln. Yazidis, which can be spelled Yazidi with an E or an A or a ZD, they are an ethno-religious minority population from northern Iraq, Syria, and Turkey. All of the women in our study were from northern Iraq. Yazidism is believed to predate Judaism, Islam, and Christianity, and Yazidis believe that God entrusted the affairs of the world to 7 angels. The highest among them is Talsi Malek, or the peacock angel. So that's why I have peacock symbols throughout the section. As an ethno-religious minority, Yazidis have been persecuted since dating back to the Ottoman Empire. Most recently, people might have heard about the 2014 genocide by the Islamic State of Syria and the Levant, or ISIS, which was committed in the Sinjar, really kind of known as the Sinjar Massacre in August 2014. More than 5,000 people were killed, 7,000 women and children were abducted and used as, continue to be used, sold and used as sex slaves. And in terms of forced migration, more than 200,000 Yazidis fled the Sinjar region. And that's that northwestern part on the map where you see Mount Sinjar. Because the US tracks entries by country of origin and not ethnic group, it's not really known how many Yazidis live in the United States, but some regional experts have guesstimated that approximately 10,000 live across the country. So it might be surprising, or it might not be surprising. Nebraska is a pretty welcoming state when it comes to refugees in terms of per capita resettlement. So Lincoln is home to about 3,000 Yazidis who have moved to the city both through primary resettlement and then secondary migration if they know somebody who lives here, or if they're seeking a larger community, if they got resettled somewhere where there's a smaller community and want kind of to live near more Yazidis. In addition to 2 really wonderful refugee resettlement agencies in town, there are 3 Yazidi cultural centers. I know Fala's on the call. He can correct me if I'm wrong. He's Yazidi and works with some of these groups, but they focus on different areas. So some might be thinking about like the political situation back in Iraq. Some are focusing on English language learning for older Yazidi women. And there is a group that's in charge of the Yazidi cemetery, which I'll talk about in a little bit. Okay, so now that we know who the Yazidis are, let's talk a little bit about Photo Voice, which I saw some of you use, which is exciting. So Photo Voice asks people to take photos or capture images related to weekly prompts and topics, and then share and discuss these images in a group setting. So what is the meaning of these? We chose Photo Voice because it's been really successful in collaborative inquiry with refugee women in the past, and it's a unique way of identifying both challenges and strengths and unearthing community resources. So in this project, we gave women digital cameras and held a basic skill sets workshop, as well as discussed photo ethics. I will say that we had an older women's group and then a younger women's group, and the younger women really wanted to use their cell phones, so we did that, but still gifted them the phone in case a family member wanted it or if they could use it another way. So we had 9 women total who participated in 2 different groups. Again, that older and younger group. We held 8 sessions with each group for a total of 16 sessions. Women were given $20 each session and were able to print 2 personal photographs every week. So we had a little photo printer that we used on site. We also brought food to share, and then Yazidi women frequently would bring the researchers food that were culturally meaningful to them as a way to share culture with the research team, which was really beautiful. And then we used narrative analysis to when we were doing thematic analysis of the data. So you can see that each week focused on a different theme. People were asked to take pictures in response to various prompts and then would select 3 that they wanted to share with the group and discuss their larger meanings. And during the final session for each group, we planned how we talked with women about where they wanted the photos to be seen. And unfortunately, COVID kind of foiled our plans for a World Refugee Day photo exhibit at the Jocelyn in Omaha, but that was what we had been planning, and women were really excited about the potential for Americans to learn about who they are. So all of the names presented in this are pseudonyms. Women ranged in age from 29 to 69 years old at the time of the study. Most had no formal education, and then 4 had lived in a refugee camp or a camp for internally displaced persons. And then people lived in the US for from 2.5 to 20 years. So they had been here for a little bit longer than certainly than the Congolese group, where several were newcomers and had only been here for a few months. So when we asked about what health meant to people, women overwhelmingly focused on mental and psychosocial health, particularly as it related to the 2014 genocide and family separation. So the photos shared, which we thought was something interesting, women shared photos that they had taken in Iraq of kind of artifacts that they brought with them, that their friends shared with them from refugee camps and sometimes from Lincoln as well, but and they would also take photos from the internet. So they weren't place bound or time bound in any way, and that even though it was a Photo Voice project, the images themselves weren't always taken by women. Sometimes they were taken by very famous photojournalists, and I'll talk about that in a little bit. But the 3 themes that we generated using narrative analysis included trauma and cultural bereavement, using non, which is a sort of flatbread, to survive and thrive, and then preserving an identity out of place. So one of the women in the younger group shared this image that was taken by Rodi Saeed, who's a very famous photojournalist who's worked in the Middle East quite a bit, to discuss the trauma that she experienced when she herself fled to the Sinjar Mountains to escape the ISIL genocide. And it's important to note that the genocide caused enormous distress among Yazidis, whether they experienced it firsthand or whether they were in Lincoln at the time of it and were worried about family members who might have been affected by it or worried about loved ones. So you can see here, Haya talked about fleeing to the mountains. She talked about how children died, how it's impossible to cope with this. Children died when they walked. They were unable to be properly buried. So people were putting stones on top of children because they had to keep moving. And she's saying this is so impossible to forget these experiences. So this kind of ongoing trauma. And when we did this, it was, I think this group was in late 2019. So this is really something that's been ongoing and experienced by people. Family separation and loss of loved ones was something that really stood out. So one of the women said that whenever she's on the phone with her son, it's the only time that she's really happy. He's living in an IDP camp. He was, I think, 21 when the family was resettled, so too old to be resettled with them, which speaks to so many of the issues that we have in US refugee resettlement that is a separate rant that I can get into. But she's saying, because I worry, like I always take medicine to fall asleep. So she has a lot of concerns about her family, and that's something that many of the women expressed. An older woman shared that after her sister died of cancer in Iraq, the only time that she felt relief was when she visited the Yazidi cemetery outside of Lincoln. So the Yazidi cemetery was built a few years ago. It's newer, but it's a national cemetery for Yazidis. And she said that, it's the only time that I have relief. I go and I sit there and I cry. And talking about kind of bereavement, one of the younger women talked about culturally meaningful bereavement traditions. So she shared a photo that she took in northern Iraq of a woman's braids in a cemetery. And she described how after a loss that women will often cut their hair shorter. It's a way of saying that life's beauty left with your departure. And she said even in Lincoln, if you see people with shorter hair, or if you go to the cemetery, that this is something that's still done. Okay. And then our second theme, so using non to both survive and thrive. Non was literally used to survive the 2014 massacre when Yazidis fled to the Sinjar Mountains. Nadia is talking here about how people, they grabbed flour, they grabbed bread, they shared it. It was the only thing that they had to live on. And when there was no more bread, they'd use the flour to make more. When there was no more flour, the men would leave the mountain to collect wheat from the nearby fields, and the women cooked. So you can see that there's a great deal, people really depending on each other, so that there's this Yazidi, there's this non as survival, but then there's also this really tremendous sense of community where people were helping each other in this situation. So it's also important that women discuss non as a way to describe their cultural values. They talked about how they wanted to share non with their American neighbors. And when they talked about it in this way, it was a way to really index distress. So they're saying one of the women had an argument with an American friend, and she was saying, if I were to take non to a neighbor from my culture, there's a mutual feeling of friendship, but saying like Americans don't always accept non, or they don't understand. And that's a way of just expressing that people really felt out of place or displaced in a lot of, they didn't sense that they belonged. And that was a way to talk about that. But they also used it to talk about some of their cultural values, such as reciprocity, of generosity, giving non to poor people. That was something when we wanted to give women the $20 for participating. They said, oh, maybe we can give it to poor people here. And that's something that even during COVID-19, Yazidis are coming together to cook for people who are not as well off as how they view themselves. And then non also was a way to integrate. So women viewed their skills making non as a way to connect with Americans in different ways. And you can see Nora, one of the women, said that she was asked by a pastor at a church to make non for the congregation. And she was so proud because all of the women, they didn't really know how to use this tandoor oven. And she was just laughing at basically how Americans can't cook, which is true for me. But she was they were asking how to put the bread in the oven, and she was warning them that they would burn themselves. And she says when we share these foods or when we teach people, everyone's so happy. And it really gave her a pathway to connect with the host society or host population. Just checking the time. Okay. And then finally, tremendous importance was placed on maintaining this strong Yazidi cultural identity in the United States. So religion is seen as a source of cultural pride, as our traditions. They're passed down often from mothers to young children. Women said it made them happy to be able to teach their children to cook Yazidi food, to teach them about the holy days, including things like fasting. So you can see here, these are other pictures that were taken from the internet that women shared with us. Some of these are taken at one of the parks in Lincoln that a lot of the Yazidis call Yazidi Park because they use it so often. People live around that area. And that's where the New Year celebration is held every April. So ritual and routine also helped older women kind of organize their day and to make meaning of hardship and feel connected to really Yazidis around the world. One of the women, I love this quote, she was talking about this prayer that Yazidis pray all the time, and they ask God to protect all of humanity. And then they pray for animals, people in prison, all of these other people. And then finally, we ask God to include us. So I said, does this mean that you're always last in the prayer? And this woman said, yes, we fit in afterwards. But then she paused and said, actually, since the genocide happened, we always pray for ourselves first. So humor is another way that people are kind of making meaning of and coping with these past atrocities and hardship. And then finally, Yazidis really placed an emphasis on establishing boundaries to preserve this collective ethno-religious identity, a great sense of pride in the language Kurmanji, which is seen by many people as separate, so not just a dialect of Kurdish, but a separate language. Some of the women referred to it as the Yazidi language, not even wanting to call it Kurmanji. That differs in the community, I found, so who calls it what? But there's a lot of sense of pride. So this is the Yazidi temple in Armenia. People really want something, a building like this, kind of out where the cemetery is on the west of Lincoln, so that they have a place to teach the youth about the language, about the different holidays, to celebrate and cook together. But one of the older women is saying, I'm not an Arab, I'm not a Kurd, I'm a Yazidi. So she doesn't want to be known as somebody from Iraq, but she really, especially where people are able to be fully Yazidi in the United States, want that. A very strong stance across people on marriage being something that's focused only within the Yazidi women, only within the Yazidi community, where a lot of people will be ostracized if they marry outside of the community. This is something that's been challenged in a resettlement context. So it used to be, there's a lot of literature that talks about Yazidis marrying within certain caste systems. That seems to be a little bit more flexible in a resettlement context, but there's still a strong stance on wanting to marry other Yazidis. People raising young children said, oh my gosh, how are we raising like truly Yazidi children out of place? That was something that was incredibly stressful for them. Like, how do you raise Yazidis when your children are going to Lincoln Public School? So that was just another stressor for people, but something that they viewed as incredibly important. So what does all of this mean? And I think the research implications are that within photo voice, that it's important not to define community for participants or to limit things. If we had said, if our prompts had been really specific to saying, you know, take a picture of something that happens this week or something that happens in Lincoln, we wouldn't have learned all of these really beautifully culturally meaningful coping strategies that people use. So there are lessons from the past that influence well-being in the present. And the way that people talked about community and belonging has different meanings for people affected by forced migration. So again, really paying attention to where people feel safe, what they view their communities to be. In terms of practice implications, psychosocial health was poorly affected by the genocide, regardless of where people were. I think this is really important, that people need to be aware of socio-political situations that are happening globally, not just in the United States, and then working with communities to support collective mourning, collective healing rituals. Something that the Yazidis do every August 3rd is, and I'm never in Lincoln for this because I always go back home to Philadelphia, but they have this beautiful walk to remember people who were killed, people who were abducted during this time, to celebrate the community. And that's at Holmes Lake Park. And they love for other people, for people from Lincoln to go and support them. And it's a way of just feeling that they have the support from the broader community. So women's resilience, continued implications for practice, that community structures are very much able to support resilience. So the Yazidi Cemetery is a great example of that, the National Cemetery that people built, being able to host events at city parks. So I think when we're thinking of well-being, we have to think of placemaking, that they are so intertwined that we need to identify spaces for prayer and communal gatherings. So when you're thinking about like writing grants, kind of think about like, do people have spaces or places where they feel that help them feel well or healthy? In terms of therapeutic or clinical interventions, or even for those of us in research, again, these stories of like when people were talking about flatbread, they weren't talking about flatbread. They were talking about they were using culturally meaningful ways to talk about distress or to show pride in their community. So really recognizing idioms of distress, which Nichter coined in 1981. Another one is Kiermaier's working with metaphors, which has a lot of great clinical interventions. So there are limitations to this. This was a convenience sample. There was huge variation in how long women lived in the United States. So it made us impossible to tell how length of time in the host country affects resilience or well-being. And then because many of us were outsiders, that could have influenced women's responses to questions. We did have 2 Yazidi members on the research team, but the remaining 4 of us were myself and 3 really exceptional PhD students who had a lot of incredible insight throughout. But yeah, we tried to balance that out with having as many sessions as possible, but you still never know how people perceive you to be. So in summary, people view health differently depending on their cultural background, on their histories, on their sociopolitical positionalities. So these health promotion interventions really need to be culturally tailored. I always, and this is the anthro in me, that I love the symbolic value of stories. I'm thinking about symbols and metaphors, and how can we use them when we're thinking about developing programs or interventions in ways that are salient to different groups. And then finally, thinking about how we promote health and healing and community well-being at family, household, or community levels, which I think is so important. We disseminated these, kind of trying our best to adhere to CBPR principles. So we worked with the community to, let's see, so we disseminated this at the New Americans Task Force Mental Health Subcommittee. Our photo voice exhibit that was run by the women was unfortunately canceled. We do have a few practitioner articles and conference presentations, and then scholarly manuscripts. So one in qualitative health research and one that we have a revise and resubmit. So fingers crossed that will be accepted soon. This would not have been possible, the photo voice portion, without a UNL Layman Award. The participants and our community partners were absolutely outstanding and critical at every step of the way. So those are my acknowledgements. And then, are there any questions?